In Hong Kong, we have established a diabetes registry since 1995. But we established this registry as part of a quality improvement program. In some ways, because of necessity, we have too few doctors to really try and manage this growing number of people. As a result, we empower our nurses and paramedics to use structured protocol to actually systematically evaluate the risk factors and complications. And because we have a good kind of system where we can track clinical outcomes, this gave us a lot of insights into the complexity of the interactions between risk factors and complications on the clinical outcomes. So essentially, I think age, sex, disease duration are very important. Generally speaking, I think males are at higher risk for heart disease. Age is important, but more important is actually duration of disease. And that is the reason why young people are so at risk. Sometimes young people feel kind of a little bit complacent because, I'm young, right? But they don't realize that in the case of chronic diseases, they are very high risk because of this exposure to these risk factors for 40 years or so. And they are going to have major problem in the prime of the life. The other interesting phenomenon that we've noted is that albuminuria and renal dysfunction are the most consistent risk factors for cardiovascular diseases, for stroke, and also for heart failure and for all-cause deaths in our populations. And I think this point is now actually increasingly being recognized, that the kidney is actually also very vulnerable to this kind of cardiometabolic kind of perturbation, not just the blood pressure and the lipid, but also the metabolic syndrome. And I think protecting the kidney is actually very important in terms of protecting heart and also brain as well.